Our breath is the simplest form of nourishment that we can provide for ourselves. When we breathe in, we're taking in oxygen, and it helps with all of the systems, going through the circulatory system, helping with the muscles, helping with the nerves. So when we are congested and aren't breathing correctly, we're losing a basic nourishment that we receive on a daily basis that we don't even think about. So this little flow that we're gonna do is to help relieve congestion or any long-term effects from COVID, any kind of chest congestion that you may be feeling, or any upper respiratory or respiratory issues that you may be feeling. So I hope that you enjoy this little sequence. So what you'll need for the practice is 2 blocks and yoga tune-up therapy balls, or you could use tennis balls or even a citrus like a lemon or an orange or something like that. I highly recommend not using a lacrosse ball or a really dense, hard object because we're working with our soft tissues and we don't want to press too hard into the soft tissues. Okay, let's get started. So we're gonna just place the therapy balls off to the side, place 1 block off to the side, and we're gonna begin to open up our upper chest cavity. So using 1 block on the medium setting, we're going to aim to access our latissimus dorsi, or the muscle that wraps around your shoulder and sweeps all the way down through the back to help open up our intercostals and our rib muscles. So what we'll do is we'll work to bring the block just about into our upper armpit and a little lower. So resting your armpit around the block, and you're going to place your head in your hand and allow your chest to just sink down onto the block. So I'm feeling a little bit of pressure in my armpit and into my upper rib cage here. So just closing your eyes, beginning to find some breaths. Just breathing in and breathing out. And just slowing down your breath, even if it's feeling congested or even if it's feeling tight or harder than it normally is to breathe. Just allowing yourself to experience whatever your breath is at this current state and giving it these tools to help it open and to help more breath come into the lungs. Slowly breathing in and out. Inhale and exhale. About 2 more breaths. And just allowing each exhale to allow your musculature and your bones to drape over the block, really sinking into it to help push the muscles out of the way. We're going to add some basic movement of just rocking our sternum down towards the ground and then slowly peeling it up towards the ceiling. So I'm just rotating my thoracic spine or my rib cage down towards the ground and up towards the ceiling. And the block should be pressing into this area, into your lats, into the armpit, and into these upper ribs. If you feel an area of tension, I just want you to stay there and breathe. Breathing deeply into that space so you can feel the muscles opening with the extra oxygen. And continue onward with rocking the chest forward and back, or vice versa, back and forward. Wherever your area of tension was, just going back to this area of gently rolling the chest open towards the ceiling and back down to the ground. So we're helping to open up our upper chest, the pectoralis muscles in the chest as well. A lot of times we feel tension here, and so we're rolling the block into this area and helping it so you can release a lot of the pressure from your pectoralis minor and major that holds into your upper arm bone here. And then take a nice breath in, come back to center. Slow breath out. And then we're just gonna switch sides. So just flipping over and taking it to the other side. So once again, lining up through the armpit, feeling your upper armpit into the edge of the block as your arm bone comes into the other edge of the block. Popping your head up onto your hand and letting your chest sink. My hips are just gently stacked, and I am able to find a little bit of comfort here. Starting with a few breaths in and out. And each exhale, you allow yourself to sink a little further into the block, a little deeper into the block, allowing the tension and the grip of the muscles to soften as you exhale. And seeing if you can relax the other area that we just opened and just worked. And really trying to focus your attention and your airways into this area that we're adding the pressure to with the block. And on your next exhale, begin to incorporate that movement of rocking your chest down to the ground, feeling the block dig a little deeper into the upper chest, and then slowly rocking your chest up towards the ceiling, feeling it rock more into the back of the arm. So coming forward, rolling down, inhaling up, and exhaling back. Just rocking forward and back, releasing the tension in the upper chest from this holding, right? If you've been coughing a lot, it's going to constrict these muscles, act as an armor barrier to the chest, making it more restrictive to breathe. So by doing this simple motion of rocking forward and back, you're actually able to help open the intercostal muscles and the muscles that support the upper chest. And once again, pausing in any spot that may feel a little bit tighter, a little bit more restricted, and it may be different than the other side, right? Our bodies are not symmetrical as much as we'd like them to be, but allow yourself to find this spot on this side of your body where the tension is holding, and just breathe. The slower and the deeper the breath, the more release that you'll feel, even if it might feel restricted at this time. Slowly coming back to that movement of rocking forward and rocking back. And then coming back into the center point, take a breath in, slow breath out, and then slowly you can help press yourself up with that top hand, coming on up. Great. Now we're going to find those therapy balls. You should feel opening around the upper chest here. Should feel a difference. And we're going to remove the therapy balls from the toe. So starting in our sternum, we're going to find the area where our pectoralis major muscles, or these two big muscles in the front of the chest, connect to the breastbone or the sternum. So we're going to take a therapy ball and bring it straight to the center of your sternum between your chest. And then slowly begin to take the ball and spin it so you can start to see the skin finding some tension. It's best if it's on your skin and not on cloth, but if you have a higher neck shirt, that's okay too. But really trying to get the skin to grip so you can see it wringing out, twisting it out. And then breathe deep in And deeply breathe out. And keeping that twist, that lock, that tension on the skin, muscles. 2 more breaths here. Inhale. And exhale. And then we're just going to take the twist and wring out the other side. So begin to use your hands to manipulate, twisting into the skin, seeing how the skin is getting gripped. And then 4 breaths here. Inhaling nice and deep. Exhaling nice and deep. Inhale. Exhale. Nice. 2 more of these deep breaths in and out. Keeping that tension here on the skin. And slowly you can unwind and release. Just release your hand. You can hold on to the ball, take a breath in and a breath out. Should start to feel things loosening up in the rib cage. Now we're going to work to finding our clavicle or our collarbone, and we're going to roll out underneath this first rib. So we're working to get to the first rib. A lot of times when we have congestion, we end up locking up here. When we're breathing up here, up high in the lungs, we're actually invigorating and stimulating more anxiety. So that can perpetuate more illness and make us feel worse, right? So this is an opportunity for you to clear that out too. So we really want to try to emphasize trying to breathe as deep as we can, even if there's restriction happening somewhere in the sinus cavity or up a little higher. So taking the ball, you're going to bring it into your palm. Find your clavicle or your collarbone and place it underneath the collarbone and just begin to roll it across and underneath. So I'm just rolling it across like I'm rolling a piece of dough for bread. I'm just digging into this space. You can release your hand down to your side, helping your chest get a little bit more broader and giving permission for the muscles to open wider. Going all the way towards the sternum and all the way out towards your upper arm bone. Okay, and then we'll just switch sides. Super simple. Opening up the palm, taking the ball, rolling it underneath your clavicle. So finding that collarbone and bringing it back and forth, just pushing and pulling. And the pressure that I'm adding is pretty minimal. I'm just gently pressing my palm to the ball. It's a pretty sensitive area, not a lot of muscle here, not a lot of skin here. And you can reach that other arm out to the side, helping the chest get broader, pushing out through that upper arm bone as well. And then we can release that. We're gonna come up higher now into our face muscles. So you're gonna need your second therapy ball. So grabbing your second therapy ball or another orange or lemon or whatever prop you've decided to use. And we're gonna go for the longest named muscle in the body. So it's right underneath here. And it's gonna be the nose scruncher muscle, right? So we wanna access this area just above your lips and off to the sides of your nose. So first things first, each hand gets a therapy ball, and we're just gonna gently bring the therapy balls up and into this space that's just below your nostrils and slightly off to the side. And then from here, I will relax my head down and just let gravity do the work of pulling my head down into the therapy balls. Once I have this, I'm going to begin to gently pull the therapy balls wide so I create traction behind this space. So I'm just gently guiding the balls away from one another as gravity is sinking my head into the therapy balls and just pulling them apart. And this is your face, so please be gentle. And just take some breaths in with this traction. Big breath in through the nose. Out through the nose. Inhale through the nose. Out through the nose. One more inhale. And exhale. So releasing the therapy balls. Noticing if your airways feel a little bit more open. So this is the base of the sinus cavity that we're working. And we're going to move up higher into the upper portion of our sinus cavity here. So my teacher, Jill Miller, this is a sequence I've learned from her. She calls this the ball talks, like getting Botox, but for your face. We all have this scrutiny muscle within our face when we are judging someone or judging something. So we want to remove that and allow it to open, right? When we have tension here in these muscles, we're pushing on the sinus cavity, which is actually going to deplete our respiratory system as well. So nice and simple, similar to what we did at our sternum and our chest. We're going to bring the therapy ball right into the middle of the forehead and between the eyebrows here. And just simply begin to twist the ball, getting traction so you can see the skin spinning. And you want a gentle pressure here, nothing too forceful. Like I said, not a lot of muscle up here, but just gently twisting, wringing out the fascia, the connective tissue, wringing out the cavity that sits here at the front of the skull, wringing out the muscles. And then nice and slowly just begin to twist the therapy ball in the opposite direction. And just go back and forth, twisting to the right and to the left. And then you can gently release that. You might have a little bit of a red mark on your forehead, but that's good. We're helping open it up. You should feel some pressure being released in the sinus cavities now. And we're going to continue that feeling coming into our temporal lobe. When we're having congestion, our whole muscles of our skull, it's like a cat wearing a helmet, like a football helmet. And so when it's tight, it kind of pulls it all back. So we want to help soften this area. So being mindful and gentle, we're going to find our temporal lobe, which is up here onto the side of our head. And we're going to access this muscle and hopefully release some of the tension that the congestion has been pulling our face into this scrunching feeling, into this tightness. We're going to help open it up. So you can lead your block. You can place it on the lowest setting, and you're going to find that temporal lobe. So looking just north of your ear and onto the side of the skull, we're going to place the therapy ball here. And then gently coming down onto your side and laying your head onto the block. So coming down onto my side, placing the therapy ball down and my skull down. From here, there's this tendency to kind of dip your chin down to the ground. So I want you to lift your chin and have your chin parallel to the ground. So no dipping down, but have it parallel. It's just going to add a little bit more pressure to this area, which is a very sensitive area. This is also something great you can do if you're having headaches, migraines. This is another little part that you could do. So just finding your breath here and allowing your head to sink into gravity here. And then just very nice and slowly begin to make some gentle movements with your head. You can nod no. And yes. And if the ball gets away from you, you can always move it back into the space and re-add those movements. Maybe even tiny little circles with your head. Just rolling out this temporal lobe, the temporalis muscles. And if you get to a spot of tension, just stay and breathe. Big breath in, slow breath out, and then nice and slowly we're just gonna switch sides. So you don't have to do this whole flipperoo thing that I'm doing, I'm just doing it for the camera. Okay, so once again, finding that temporalis muscle on the side of the skull. Slowly coming down onto your side. We're going to place that therapy ball at your temporalis and onto the block. So just taking your time to set up, getting the chin parallel to the ground. So we're not dropping it at an angle, but it's nice and even. Our skull is nice and even. And just resting here, finding your breath, breathing in nice and slow and nice and deep. You should start to be feeling more movement of the lungs, more movement of the air coming in through the sinuses, down the throat, into this open portion of the chest that we've already opened. Should be feeling a little bit of release by now. So go ahead and add that movement now. Just shaking your head, yes and no. And it's really slow and subtle. If you go fast, you're gonna have the ball go flying out from underneath your head, and that won't be good. So just try to keep a little gentle pressure as you're finding your yeses and nos, and you can always move the ball if it gets away from you. Maybe finding little circles. Big breath in. Slow breath out. Maybe finding that little area of tension and pausing there, breathing. Allowing your eyes to close if it feels good. Just turning out all the external factors, tuning in to your breath, tuning into this release, letting go of the tension. Noticing the openness and the simple nourishment that the breath is providing. And then nice and slowly coming back and just gently using your top hand to help you come on up. Okay. Now we're gonna open up the backs of the ribs, because when we breathe, we don't just breathe in our chest, right? Our ribs and our lungs are like a big balloon. It fills up the whole rib cage. So we're going to access the back of the ribs now, getting into the backs of the lungs and in between the shoulders. So a lot of times when we're having this tension in the chest, the congestion, all the muscles lock up. So that's why we started with the side body, or went to the front, and now we'll move to the back here. Okay, so we'll take your therapy balls. You'll need that handy dandy block, so have it by your side. And we're gonna come down onto our backs. Our goal is to get the therapy balls between the shoulder blades. So we're talking about upper respiratory, upper chest. So aiming to get the therapy balls between the shoulder blades. So placing the therapy balls down onto the ground, and then working to slowly lower yourself so you can aim to get those therapy balls between the shoulder blades. And we're just gonna keep our body in this C-shaped position with the knees bent and the feet on the floor. From here, we're going to slowly begin to lower our skull down to the ground. And allow the chest to open, opening up the ribs and feeling a pressure in the back body. So feeling this arch of your upper spine. Allow your low back to find a nice neutral position so it's not overarching and it's not underarching. It's somewhere in that Goldilocks place where there's a gentle lift of your low back off the ground. And just feeling the weight of your bones onto the therapy balls now. And breathing in deep. So working the breath, breathe into the therapy balls. As you inhale, you're going to feel a little contraction of the ribs pressing down into the balls. And then exhale, allow the rib cage to open and soften, melting around the therapy balls. So inhale, there's a slight contraction, pushing your ribs into the ground, into the balls, and then exhale, slowly allow them to relax. Just do that a few more times. Inhale, contraction, press. And exhale, relax and allow the bones to soften. Two more breaths here with that contract and relax of the muscles. And those therapy balls off to the side. So let's just check in and see how we're feeling in our breath, in our lungs. I'm going to have you bring one hand to your chest and one hand to the back of your body. So whichever is easier for you, you could bring the back of the palm and the front of the palm. Just close your eyes, take a breath in. Feel the expansion of the palms away from each other. And then slow breath out, let it go. Inhale, open. And exhale, relax. One more round like that. Exhale. And you can release your palms. One final little thing to help open up and continue this movement of breath, movement of air through the body, through the lungs, is called Nadi Shodhana, or alternate nostril breathing. So we'll use our right hand for this, and it's going to be a breath where it's equal in inhale and exhale, and we just are pausing in between the inhale and the exhale, switching from nostril to nostril. So it looks like this. We'll take our peace fingers, our index finger and our middle finger, and bring them to the center of the eyebrows. And then nice and slowly, using your right hand, you're going to take your thumb and plug your right nostril. You'll inhale through the left nostril, pause at the top of the inhale, and then plug the left nostril with your ring finger and your pinky finger. Hold the breath here. And then slowly lift the thumb and exhale out through the right nostril. Inhale through the right nostril. Plug the right and hold the breath. And then lift the ring finger and the pinky finger and breathe out through the left. And that's one cycle. Inhale through the left. Plug the left, hold the breath. Lift the thumb and breathe out right. Inhale right. Plug the right, hold the breath. Lift the left and breathe out left. Inhale left. Pause at the top and plug. Lift the right and breathe out right. One more round, inhaling right.
plugging right, holding at the top. Lifting the left side and breathing out. Release your palm. And then work to breathe in through both nostrils and out through both nostrils. Try it 2 more times. Inhaling through both. Exhaling through both. Last one. Inhaling both. Exhaling through both. And there you have it. I hope that the congestion that you've been feeling has been alleviated, at least to some extent. And you can use this practice at any time you're having a headache or feeling a cold coming on, or maybe just need to breathe. I hope you have a fabulous day, night, or evening.